The infectious COVID-19 strain is fueling a rise in cases and hospitalizations now again across Florida. So what does this mean for Tampa Bay area communities? Fox 13's Aaron Mesmer has been following this for us tonight. Joins us now in our newsroom. Hi there, Aaron. What'd you find out today? What are local experts saying about this?
Mark, the 7-day average rose to about 11,500 COVID cases a day after leveling off for several weeks. And USF Health doctors say vaccinations and previous infections are helpful, but they still might not be enough to protect you from this strain. The latest strain of COVID-19, known as Omicron BA.5, is quickly dominating infections in Florida.
We've been between 9,000 and 11,000 cases per day.
Those numbers have remained fairly steady during the last month and a half, but are on the way up, according to USF Health Dr. Jason Salemi, who's been tracking COVID in Florida since the start of the pandemic. But Salemi says this subvariant has shown some concerning quality.
Seems like it's got a characteristic of is being better at infecting people with prior infections and infecting people who have previously been vaccinated.
Dr. Salemi says scientists are trying to determine how much protection prior infections provide. He says a recent study found that people who've been infected with Omicron are 70 to 80% less likely to get reinfected by the BA.5 subvariant. That same study looked at infections caused by previous variants.
How much does a pre-Omicron infection protect you? And the answer to that is not very much at all.
He believes that has helped fuel a rise in hospitalizations, which doubled in the last 7 weeks. But Salemi and Mary Mayhew, president of the Florida Hospital Association, agree that context is important.
And let's remember, last August, during the Delta surge, we reached a peak of 17,000 COVID hospitalizations.
Experts hope lessons learned during those previous waves will help hospitals and the public get through this one.
The benefit of the last 2.5 years has been the increased sophistication within our hospitals around their emergency preparedness, their surge planning.
Yes, the numbers are increasing. We should be taking action now. We can prevent people from being hospitalized and dying.
Yeah, here's some more context. You heard her say 17,000 infections last August. Right now, that number is 4,000 hospitalizations, excuse me. And Dr. Salemi says vaccines are still incredibly important, especially for people who are over the age of 50. He believes people who got a second booster in the past month or two have a much higher degree of protection against a serious illness or hospitalization, Mark.
No doubt about that. And if you don't know somebody who's got it, Aaron, as you know, this last strain here seems to really be hitting some people hard. So not to be taken lightly. Still, Aaron, thanks very much.